Hi everyone, my name is Michaela Kern and the disease that I have chosen for my presentation is the measles. In stage 1 of the pathology of the measles virus enters a susceptible host. The virus is going to enter the host through the respiratory tract or conjunctiva. The infected cells are going to migrate to lymphoid tissues and draining lymph nodes. Stage 2 of the measles virus is systemic dissemination. The measles virus infected myeloid cells transmit virus to lymphocytes. The infected cells enter the circulation and migrate to organs and tissues. Immune cells in the organs and tissues are then depleted, which results in immune suppression. Stage 3 is transmission of new measles virus particles into the air. Epithelial cells in upper and lower respiratory tract produce new viral particles that are released into mucosal lining. Epithelial damage in the lower respiratory tract is going to induce coughing that discharges the viral particles into the air, which will then go into a new susceptible host. The measles is a contagious, very serious disease that's caused by the measles virus. In 1963, a vaccine for the measles virus was introduced. Prior to this vaccine, there were multiple epidemics, and there was an estimated 2.6 million deaths caused per year by the measles virus. From 2000 to 2018, the measles vaccine has prevented 23.3 million deaths globally. Measles deaths have decreased 73% from 2000 to 2018. There are different groups of people that are at risk for measles: unvaccinated young children, unvaccinated pregnant women, non-immune individuals, so those who have not been vaccinated and do not have immunity to measles, and individuals in developing countries or countries recovering from a crisis or a natural disaster. "10 to 12 days after exposure to the measles, the patient's going to present with very high fevers. The initial stage, they're going to have a runny nose, cough, red and watery eyes, and small white spots in the cheeks, which are called Koplik spots. They are then going to have a rash on the face and the upper neck that develops within several days of exposure. Within 3 days, the rash is going to spread from their face and their neck to their upper and lower extremities. The rash is going to last 5 to 6 days and usually occurs 14 days after exposure. Severe symptoms and complications can occur from measles. These include blindness, encephalitis, severe diarrhea and dehydration, ear infections, and severe respiratory infections such as pneumonia. Differential diagnoses for the measles include roseola, rubella, Fifth's disease, Kawasaki disease, scarlet fever, dengue fever, infectious mononucleosis, pharyngoconjunctival fever, and enterovirus. A diagnosis of measles can usually be made from clinical presentation or symptoms of the patient. If the provider is not common with measles and is not aware of symptoms or presentation of measles, there are different tests that can be collected to diagnose it. The CDC recommends for blood and throat swab specimen collection from all patients with measles symptoms. Serology or blood testing should be collected as soon as possible. If the sample collected less than 3 days of symptom onset is negative, it is recommended to collect a second sample 3 to 10 days after the onset. Throat and nasopharyngeal swabs are best if collected on the first day of the rash through 3 days after onset of the rash. PCR may detect measles RNA 10 to 14 days after rash onset. A urine specimen can also be collected to diagnose measles. Non-pharmacological treatment is going to focus on supportive care. The patient should make sure they're getting a lot of rest, avoid busy activities. They need to make sure they are adequately hydrated, so replacing fluids that are lost through fever and sweating. The patient can use a humidifier to relieve coughing and sore throat. And light may be bothersome to the patient that has measles, so the light should be kept low, or the patient can wear sunglasses. It's probably also best for the patient not to watch television or look at a computer screen or anything that could bother their eyes from the light. There's no confirmed treatment for the measles. Post-exposure vaccination can be provided for the patient that has measles. If they're non-immunized individuals, they need to be given the vaccine within 72 hours of exposure. Immune serum globulin can also be administered. This is given to pregnant women, infants, and immunocompromised individuals. If it's given within 6 days of exposure, the symptoms can be less severe or it can prevent measles from occurring. The patient can have fever reducers such as acetaminophen, naproxen, and ibuprofen. They should avoid giving aspirin to these patients to decrease the risk of Ray's syndrome. Antibiotics can be prescribed to the patient if they have a complication from measles, such as ear infections or pneumonia. And vitamin A has been linked to decrease the severity of symptoms of measles. If the patient is older than 1 year old, they should be given 200,000 units. The patient with measles should be isolated for 4 days after the onset of the rash. In the healthcare setting, the patient is going to be put on airborne precautions and placed in a single patient room that is for airborne infections. The healthcare professional should make sure to wear an N95 mask or a different respirator that can filter out the particles, and that's effective for airborne rooms. Measles can be prevented with the measles, mumps, rubella, MMR vaccine. There are 2 doses to this vaccine. The first dose is 93% effective at preventing measles. 2 doses are 97% effective in preventing the measles. The vaccine can be used for children aged 12 months to 12 years. The first dose of the vaccine is given at 12 to 15 months of age, and the second dose is given at 4 to 6 years of age. If an adult is born after 1957 and has no evidence of immunization or immunity, at least 1 dose of MMR should be administered. All individuals 6 months of age and older should receive the MMR vaccine prior to international travel. If the individual is less than 12 months of age, they will need 1 MMR vaccine. And if they are above 12 months of age, they need to have 2 MMR vaccines prior to international travel. Follow-up and referral. Moderate and severe cases of measles may require admission to the hospital for management. For a moderate case of measles, the patient may require IV fluids or respiratory support, such as nasal cannula or high-flow nasal cannula. Severe cases may require non-invasive or invasive ventilation or management of worsening or severe sepsis. If complications occur from measles, the patient should be referred to the appropriate specialty. If the patient has an issue with their eyes or a complication with their eyes, they should go to an ophthalmologist. If they have an issue with their lungs or an infection, they can go to a pulmonologist or infectious disease provider. Follow-up with primary care providers should occur within 2 days after diagnosis of the measles. And those are my references. Thank you.